Okay, in this video demonstration, Theo and I will be going over the corrective exercises for the excessive forward lean impairment. So again, we're going to start with our foam roll exercises, and with this impairment, we're starting off with the foam roll for the gastrocnemius and the soleus muscles. So Theo's going just above the heel, working his way up towards his knee on the lateral aspect or the outside of the calf muscle. Again, all he's doing is looking for those tender spots. You find one, you're going to hold for 30 to 45 seconds or until it releases. And he's going to flip over, and we're going to foam roll the hip flexor, specifically the Rectus femoris muscle, which is a quadricep muscle. So he's going to actually go up from the hip area, the groin area, all the way down his quads. So from the knee up to the hip. Working his way down, belly's in tight, pivoting. He's going to get right up in the hip flexor area, there you go, just like that. Again, he's going to pivot a little bit. Again, think of seek and destroy. He's just looking for those tender spots. When he hits a tender spot, he's going to hold for 30 to 45 seconds or until it releases. Okay, now he's going to move on to the static stretches. So he's going to stay down on his belly. He's going to do a press up for me. So it's like a push up, but the hips are going to stay down. So he's actually going to come up, exhale, let the hips drop, hold for 30 seconds, and then come on down slowly, just like that. Perfect. All right, the next exercise, he's going to go up on the knee. He's going to stretch his hip flexors. This is a combination of movements. So if you watch Theo, so he's leaning away, he's turning, arm raised, actually bringing the arm kind of at an angle just like that. Really getting a good stretch of the hip flexor area. That's a functional multiplanar hip flexor movement. Perfect. And the next two, he's going to be standing. We're going to do the calf muscle stretches. So he's got the gastrocnemius over at the wall. So leg stays straight, foot pointed straight ahead, heel is all the way down, fire in the quads, keeping the leg straight, no bouncing. He's going to hold that stretch for 30 to 45 seconds. That's the gastroc, and then he's going to come in closer, and now he's going to stretch the soleus muscle. So he's a little more vertical. As you can see, he's bending the back knee about 30 degrees, staying on the heel, stretching the lower part of the calf closer towards the heel, no bouncing, hold for 30 to 45 seconds. Perfect. All right, now we're going to move on to the isolated strengthening exercises. So Theo's going to go back down to the bridge position. He's going to do the single leg bridge with toes loaded. He's grabbing a ball, which he's going to put inside the hip, so to speak, of the opposite leg there. He's going to pull that knee up to prevent him from cheating. Toes loaded, meaning they're just pointed up. Belly in tight, hips up, and he's going to hold for a couple of seconds. Again, 15 repetitions each side. The next isolated strengthening exercise will be the floor Cobra. So Theo's going to go back to his belly, arms out to his side with his palms facing the floor. And he's going to arch up and turn the hands out, keeping the feet on the ground. Up, hold, and come on down. Hold and down. 15 repetitions. So now Theo's going to go up on his hands and knees. He's going to do the quad Supermans. Belly's in tight, not going to sag, just like that. Perfect. So if you go too far, if you see Theo go too far, his back will sag. We don't want that. Bring it on down. Again, leg out straight, arm out straight, back nice and straight, belly in tight. Hold for a second, come on down. You know Theo has his thumb in the up position. That's just safer for the shoulders. We don't want to cause impingement. Okay, so the next exercise, Theo's going to do the Dorsi flexion exercise. He's going to bring the chair over, back to the TheraBand, the foam pad there. You have to bear with us. We're on our 1000th video of the day, so we're kind of burning out here. Power up, Theo. All right, so here we go. He's stabilizing his knee joint, and all he's doing is taking the band and pulling straight ahead, working the anterior tibialis muscle, just like that Dorsi flexion. Hold for a second, come down slow. Again, 15 repetitions, good to go. Last but not least, we're going on to one integrated dynamic movement. Theo's going to put the chair up against the wall. We're going to do the squat to overhead press. Now it's important to remember for this one, because of the impairment, the excessive forward lean, Theo's going to pinch his shoulder blades together and maintain that position. Again, it's quality versus quantity. I'm worried more about the quality. He wants that chest high, scapular retractors held in place, stomach tight, chest high. He's gonna drop at he's gonna hinge at the hips and come up and press up overhead, all while keeping his shoulder blades together. Good alignment of the knees, they're not crashing in. Trying to keep the arch of his feet. As you can see, Theo has little to no arches, so he's working on his own corrective exercise program. Just like that. Chest as high as you come down, shoulder blades together. It takes a lot of concentration when you're doing this one, but we want to remember we're not worried about how many repetitions. You're all set, Theo, you can take a break. Quality versus quantity, so just focus more on the stuff we talked about as opposed to how many repetitions, okay?